Hi, my name is Shane O'Connor, Medical Exercise Specialist, and I'm here in New Rochelle, New York at New York Fitness Professionals to talk about diabetes today, more specifically type 2 diabetes. Type 2 diabetes typically comes about through poor lifestyle changes, physical inactivity, poor nutrition choices, and it's diagnosed by a medical professional. The medical professional will diagnose it, but then they'll perhaps give you some type of drug intervention to help deal with it, which is absolutely necessary at times. And they'll tell you that you need to make a lifestyle change, and they'll guide you in a direction towards better nutritional habits or a professional that can help you with that, and also exercise habits, and perhaps a professional that can help you with that. Lifestyle change is absolutely necessary in order to combat this disease, and without it there's really no way to return to the body to homeostasis, which is its natural state of being. The issue is that you may have trouble finding where to get proper help for this, and here at New York Fitness Professionals we have medical exercise specialists to help with that, which I'll go into in a little bit. Let's first talk about what is type 2 diabetes. Type 2 diabetes, it's an issue with glucose being able to enter the cell properly. This can happen in ways such as the pancreas can have a burnout effect where it stops producing insulin, or the cells become resistant to insulin. Let me explain what insulin does. So what happens is when glucose enters the bloodstream, it needs to enter inside the cells so that it can leave the bloodstream. The way that it enters inside those cells is through insulin, which the pancreas secretes. Once the pancreas secretes the insulin then goes, and it's almost like a key to unlock the cellular door. And it unlocks that door, and then the glucose enters. Right? And we decrease the amount of glucose in our bloodstream. If you don't have this ability to do this, if the cells become resistant, or the pancreas doesn't secrete enough or any of the insulin, what happens is we have a toxic amount of glucose within the blood supply. This can cause damage to the blood vessels, affecting the eyes, the extremities, kidney damage, and the list can go on and on. And these conditions can eventually become life-threatening, which we obviously want to stay away from. So intervention needs to be taken. Intervention needs to be done, rather. And what we need to do is we need to start to incorporate better lifestyle changes. Now, exercise is what I'm really here to talk about, is an amazing thing, because what exercise does is it gives you the ability to, it gives the cell the ability to uptake insulin independent, uptake glucose independent of insulin, meaning that without that key it can then enter into the cell and you can decrease the amount of glucose in the bloodstream. And it also has other effects such as weight loss, such as help with musculoskeletal injuries, all positive. Now, what happens is we find the type 2 diabetics that come through this door, they're not just dealing with type 2 diabetes, they're dealing with weight gain, they're dealing with musculoskeletal injuries, perhaps hypertension, among various other problems. And this is where the medical exercise specialist really steps in, because the medical exercise specialist, first of all, can help you deal with your type 2 diabetes, making sure that you're in safe ranges in terms of blood glucose levels, first of all, to actual exercise. We'll also work directly with your medical professional so that we can work on your specific case and help your medical professional and yourself manage your condition. And then you have all these other underlying problems such as musculoskeletal injuries, like maybe a knee injury, hypertension, whatever it may be. We have the tools and the education necessary to deal with it. So then what we do is we develop a program specifically that meets your needs, and then all those wonderful things that I just talked about exercise does for type 2 diabetes, they happen. And eventually we get you back to what I just said before, which is homeostasis, your body's natural state. But without lifestyle changes and without exercise, it's very difficult and almost impossible to do that. So, you know, just come on down, give our website a look, give us a call, and let us help create a program for you. Hope to see you soon.